I'm Debbie Statler, Editor-in-Chief of Provider Magazine, and today I'm here with Betsy Johnson, President of the Kentucky Association of Healthcare Facilities and the Kentucky Center for Assisted Living. Thanks for being with us.
Thank you for having me.
Well, let's start at the beginning. How did you first get involved in long-term care?
Well, I've been in this position for 9 years. Actually, June 1st was 9 years, but I'm an attorney by training. So I've been worked in government, Medicaid. I was also in private practice. So I've been in the provider world, either being the regulator or the payer or the attorney, but love this role. But actually, my father was a nursing home administrator in both Ohio and Kentucky. I didn't think much about it because he did it in high school. He's a Presbyterian minister, worked for Presbyterian Homes in Louisville, Kentucky. They're members of mine, so it's kind of a full circle.
I find a lot of people have a family connection somewhere to the world of long-term care.
Yeah.
Well, what are the top legislative and regulatory priorities in Kentucky for long-term care right now?
So legislatively, next session, starting in January, we'll have a budget session. So we are asking, like I'm sure you're hearing from other state executives, an appropriation to rebase our Medicaid rate. Our Medicaid rate has not been rebased since 2008.
Wow.
And I mean, you can think what's happened in the past 4 years, you know, for COVID and post-COVID. So it is time to rebase that rate. And the current governor's administration agrees. Now he's up for re-election in November, so there's a lot of moving parts there. And then also we have to have the appropriation from the legislative branch. But we're also working with the current administration to potentially provide some of that funding early, July 1 of this year, because my members are telling me they can't wait till July 1 of 2024. So we're calling it a bridge to rebasing payment. I was texting to see if there's any news from Kentucky. We're expecting that information to come down pretty soon.
Oh, I bet that will make a huge difference.
Yes.
Well, you recently had a new workforce law signed in Kentucky. How will that help solve some of the workforce challenges going forward?
Right, so that's House Bill 200. We were very involved with that, went to the table with the legislator, Representative Kim Fleming, who's a forward-thinking legislator. It's a unique concept. It's kind of modeled after something that was done in Florida, limited to nurses. It's a private-public partnership. So it incentivizes healthcare providers to donate money, and then it will be matched by state funds, general fund dollars. And it contains a whole array of scholarship opportunities from physical therapists, everything, but of course our focus was nurses and nurse aides. We made sure that nurse aides were in there too, because we firmly believe that that's the pipeline to more nurses. And of course nurse aides are the backbone of long-term care. We've heard about some hospital systems in Kentucky already willing to donate a lot of money, so we're going to be meeting with the Council for Post-Secondary Education, which is the agency that will be administering this fund, to see how our providers can start donating money and get that matched so we can get those workers in our buildings.
Oh, wonderful. The workforce challenge just is such a big issue for providers across the country.
Yes.
So how has advocacy in general changed throughout the course of your career? You've obviously served different roles and different sides. Has it changed much?
You know, that's why I went to law school, because I like to advocate on behalf of people and organizations. I like to solve problems. I would think since I've been in this role, the legislature has significantly changed. We used to be 10, 15 years ago, we had some Democrats in our legislature. We don't really anymore. So it's a supermajority Republicans in both the House and Senate. So that, provides a dynamic, as a, lobbyist, as an advocate, you have to, figure out how to play that, because when you don't have any real bipartisanship, you're dealing with one group of people, right? And you have to convince them. And also there's been a lot of change with regard to the actual legislators. We are a citizen legislature, but so there's some longevity, but now we have new faces. And I'll tell you, I've been working inside and outside government for 30 years, and learning the new players has made my job more difficult.
Interesting.
Yeah.
Yeah, the changes just in politics across the states in general, I'm sure it plays out in the state legislators a little too. What advice do you have for providers and your members if they want to get started in working in advocacy and telling their story and making these relationships with legislators?
So of course we always say you have to join the association because I mean it's a cliche, but we are better together, clearly. And then get involved with our committees. Run for the board. We just had an election last month, and there were some contested races, which makes things exciting. A lot of new faces, younger people coming in. But just get involved. We have a day in Frankfurt, which is our state capital. We encourage people to come. Of course, we encourage people to come to congressional briefing in Washington, D.C. and meet with our members of Congress. It just, you can start small, because I can tell you a lot of them can be intimidated, like, oh, I don't know how to talk to my legislator. But then you get them in a room and they know their stuff, and they would much rather hear, a member of Congress or a legislator would much rather hear from one of my members who are actually doing the work than me, as a paid lobbyist, if you will. So once you get them in the room, they just shine, and they really can convince our legislators that we need their support.
I like that idea. Start small. Don't be intimidated.
Yep.
Wonderful. Well, thank you for spending a few minutes with us today.
Yeah, thank you for having me.